The rural generalist pathway essentially aims at training rural generalists from the beginning of their training all the way to until they get their fellowship. It's aimed at making sure the trainees get the rotations that they need to begin their training, and also once they become registrars, to make sure that they are able to rotate through primary healthcare but also through the hospital terms. As part of the rural generalist training, the doctors are required to do an advanced skills training, which could be in obstetrics, anaesthetics and emergency, where they spend 12 to 18 months in that specific discipline. In Kalgoorlie Health Campus, they are able to do their anaesthetic diploma now. Starting from this year, we've just been accredited. They can do the advanced diploma in RANSCOG, which is what's required to be a GP obstetrician, or as we're planning to aim by the end of this year to be able to do your diploma or advanced diploma in emergency medicine as well. The registrars can join at any point of their fellowship or their training program. If they do join early as a JMO, they are able to do what we call their core rotations at the hospital, rotating through pediatrics, emergency, some obstetrics, psych. The length of the training as a rural generalist can span between 4 to 5 years. Obviously, after they finish their training, they can stay on as a fellow, depending on which discipline they're working in and what the needs of the community and the hospital is. In terms of clinical support, there's really good supervision from very experienced non-GP specialists. There's mentorship available. I often will meet up with the rural generalist trainees and make sure they are given the right career guidance based on where they want to be. There's also some social support. So recently, in the last couple of years, the GMO Society has been set up. They run some events for the GMOs to be able to socialize with each other. We do weekly simulation sessions. They are run by experienced clinicians. We also do a lot of hands-on workshops. Kalgoorlie Health Campus is a really good hospital that sees a lot of acute medicine through the emergency, surgical and medical units, and for the trainees it's a fantastic opportunity to have such exposure. The consultants or your supervisors know you, know your abilities, they know where you may need help, and they feel a bit more confident to let you run a few things by yourself and intervene only when they think is required. I think the best advice I can give is to look at what they want to achieve from their work life, in terms of training requirements, in terms of exposure at work, and have a chat to some of the head of departments from the hospital or the DCT and see what options we have at the hospital will meet their requirements.